Beautiful.
Yeah, my family got together last week, everybody. So why don't we just go ahead and move on? I think we don't need quorum for this. I think you're just trying to finalize a few changes or things that you added. So why don't we go forward? Start with roll call. Marcy, do you mind doing that?
Sure, that's no problem. So without quorum, then we'll postpone item B just as a FYI.
Right.
Okay.
I'll start with you, Kathy.
This is Kathy Lewandowski, Work Plan Review Chair.
Bianca.
Hi, Bianca Demara.
Thank you. And Melissa.
Hello, Melissa Van Hook, Council Chair, Committee Member.
All right, I'll start and then staff. John.
John Myers, Executive Director.
Thank you. Jason.
Jason Sneed, Research and Communication Specialist.
He's on vacation right now on his boat. Oh, Megan just joined us.
Oh, good.
Good morning, Megan. How are you? We're just doing intros.
Good morning, everyone.
Thank you. Sarah.
Sarah Roof, Communications Director. Good morning, everybody.
Bonnie.
Bonnie St. Cyr, Fiscal Manager.
Is there anyone else?
I'm here. Michael
I'm
Leba.
sorry, Michael, you're making all the phone calls. There you are in the corner. You
That's
moved.
okay. Good morning, everyone.
Good
Glad to be
morning.
here.
Okay, there we go. Back to you, Kathy.
Just give us quorum now.
Yes.
Okay. Well, welcome everybody to our Work Plan Review Committee meeting. I would like to have a motion to, if you've reviewed the Work Plan Review Committee meeting minutes from May 17th, have you all had a chance to do that?
Yes.
Okay. Do you have any questions or changes, suggested changes?
I don't.
Okay. Could I have a motion to pass the Work Plan Review Committee meeting minutes for May 17th, 2024?
So moved.
Do I have a second?
I'll second.
Okay. All in favor of approving the Work Plan Review Committee meeting minutes of May 17th, 2024, please say aye.
Aye.
Aye. Anybody opposed? Say nay. Okay, the meeting minutes are approved as is. Okay, so the next on the agenda is the review of the federal fiscal year 2025 annual work plan proposed, and that will be by Marcy and John. So I'll turn it over to you guys.
Okay, and I will provide a brief preface here that we're not doing a recap of fiscal year 2024 as part of this meeting because, in fact, we sort of are doing a recap of 2024 as we go through 2025's work plan. You'll see there are sections of the work plan that are that are lined through, and those are some items that will drop off. Either because the grant is ending or because the project is ending or it's just no longer an issue. There are some things added, which we will explain to you. And we'll give you an update as we go as the 24 items relate to fiscal year 25. And I may be wrong about that. The strike throughs, I'm looking at the copy that I have here and it doesn't have those. So, oh, there are some. Never mind. Sorry, I'm a little confused. But we'll give you an update on where things stand with regard to 24 as we talk about the 25 items. I hope that makes sense.
Yeah.
Okay, good. Marcy, I am going to turn it over to you to start us off, and we may have the relevant staff members who are responsible for particular goal areas, like Mike for Meaningful Careers, and Jason on some of the primary projects, talk about their portions of the plan as we go.
Okay.
Marcy?
Are you going to pull these up for me?
Oh, sure, I could do that.
Okay, I'm assuming everyone has, all be able to view these online or either pull them. So I'll just cover the first goal. We'll just do this in order of the goals. So the first one is the self-determination, self-advocacy. And basically the first activity under the first goal is the second year contract with the ARC of Arizona through the ARC of Tempe. That is added into the 25 work plan through the contract is an additional 1 year through June 30th. So there's no change in that. Anything in yellow that I have highlighted or is information that I need to pull. So for example, this one says the final report, which was submitted into me about 2 days ago. I need to review that, and then I will update any of the performance measures. But usually the performance measure itself will stay. It's more of the output numbers that I will make sure that it corresponds. Next one, please. Next page. The second objective has a number of different advocacy projects, and this is what we'll get into some things that will fall off. First activity doesn't change. It's the renewal for support decision-making, again, running through June 30th. And the same thing, I will update performance measures. The second activity relates to the conference sponsorship grantees that were just awarded. And per discussion at the last time, we are removing it from an activity into 2026. So this will be the final year of doing conference sponsorships. And then we're going to reassess and see what sort of, how well the projects do and bring information back to the council to see if the council wants to do another activity around conference sponsorships in the future for the next 5-year plan. Activity 3, community survey. Sarah and John this was only in regards to, because the actual community survey is in a different goal. This is only in related to getting information from self-advocates around their barriers and challenges to participation. Kathy, I believe this was an activity idea that came from you. So I brought that up to Sarah and making sure that one of the questions in the community survey that will be released later on this month has a question regarding that. And then take that information back for us, obviously, to make any further outreach, but definitely information back to the ARC of Tempe because they are the lead in the self-advocacy mandate.
Okay.
Again, anything in yellow I need to work out further. Activity 4 does not change. It's a carryover of where our office assists 5 self-advocates to help them in public speaking. That will continue on. That's been something that's been in our work plan since the beginning of this 5-year plan. Number 4B, Sarah, this is the Speakers Bureau Community Collective. I don't know the status of it too much, but we're keeping it into 24 and 25 and 26 so that we make sure that it gets implemented. Probably more time to kind of assess how that will happen or whether Sarah's going to have a different name. Sarah, do you want to add anything very quickly before we move on?
We're adding people to the list on a near weekly basis. And we did an Instagram poll to help decide the name. So that's coming shortly.
Good.
Exciting. Okay, moving further down. Number 5 is a legal options manual contract that we have with the Sonoran USAID and with Disability Rights. They are updating the manual to be completed by the end of January 2025. Will be in English and Spanish versions in plain language. So it's a contract for a short amount of time, and we're adding it into 2025, obviously, because it runs through part of the year. So that's exciting to know. The bottom half is where, just know that I have a lot of notes here because this all has to go into the Verity system. So excuse my messy notes in here. It won't make much sense to you, but it is something that I need to know. On the very next page has information about what dropped off. So this was before John told me, don't just put a line item through things. So what dropped off from 2024 is SEEP, because DRAS had the contract for the special education training program. It will end this September with 3 years of funding for it. So we removed that from the 2025 work plan. Again, number 2 relates to the conference sponsorship. We're going to hold off on doing anything further in 2025, assess whether that's going to go back in 2026 or in the new 5-year plan. And then everything gets renumbered. And then we update outputs and activities as need be. Any questions on the self-determination one?
No, I don't have any.
No questions.
All right, John, do you have any questions on it? Did I cover everything?
Seems to me you covered everything quite well.
Okay. Next one is
Okay.
Michael's and Melissa's as a chair of the Meaningful Careers work plan. We are carrying over, I believe, pretty much all the activities in here. There is just a couple of things I do want to highlight. The projects that Carla Kravakis is doing, like under objective 1, number 3, where the council will support initiatives and students with IDD and post-secondary education. She is not a direct contract. It's through a contract with ACRA, I believe. And that is a statewide contract that will end this December. We don't have any information from the state whether they plan to renew that. Carla does want to continue on with the work. And so, you know, this is the part of, you know, working with state procurement and what they have on contract to ensure that at least some part of the work can be in place. We are also still working to get her purchase order in place for her to begin any sort of work beginning the state fiscal year, which began this July 1st. So she's not doing anything yet until she gets a purchase order, and those are taking a lot of time to finalize. And Lonnie's been in communication on her end with how to get that processed. So that I just want to update you guys on that. A lot of the stuff that also came out of this Michael's work is research reports that were done last year that the council or his committee will look at recommendations. So it's really important that in 2025 that we have some sort of recommendations put into the work plan. So for example, number 5, review the voc rehab report, collaborate with partners to determine policy recommendations. Right now, this is just a statement in there. Michael, you don't know about this, but it just says council recommends amendment to policy. We're going to have to finalize that in the next 7 days in terms of what we need to do. It may just be something that we just put as a general statement, but something as you guys work through the voc rehab report, what you will bring back to the council, then we could be a little bit more specific, reporting it in the PPR for 25 and more specific in 2026. So, you know, we can't have in there just review a report. It's going to have to be something a little bit more substantial. So we'll work out some language in there. I know you guys haven't had a chance probably to meet about it, Melissa, but Michael, I know will be setting up a meeting here, hopefully in the next quarter, to work out some things around some of these reports and the policy recommendations.
Okay, thanks for the update.
Yeah, no problem. The last thing I would notate is activity number 7 under the first objective, which is a new one that Michael is recommending, and it's to support the license fee for Project Search to expand into another site. And the potential location appears to be the Deaf and Hard of Hearing School in Tucson. So we have to work out the method to pay this because it's a license fee per site of $18,000. So, but it's in here, and then we'll do our end as far as what sort of payment, purchase order, contract needs to be done, but that's in there as well. Michael, anything to change or add in here? Do you want to clarify on your first objective?
Sorry, I was on mute. No, you covered it well. Thank you, Marcy.
You're welcome. Okay, moving on to objective 2. Again, nothing is changing in terms of his activities. There's some work that Carla's doing or will be doing as soon as she has a purchase order. So that pretty much stays the same. There's a lot with the National Disability Employment Awareness Month, which is really popular in October. That usually begins right off the bat, APSI. So we'll move forward with that. No changes to number 3, objective 3, beginning on page 5 through 6. So, you know, we're moving ahead. Michael's moving ahead on a lot of things. Again, you know, just really appreciate Michael's very thorough on his work plans. And so I know he would be thorough on monitoring everything here. So we're excited about that. I'm trying to think. That's it. We did not really take anything out of Michael's.
Thank you, Marcy. Did a great job.
Yeah, thank you. All right. The next one's going to be inclusion. Probably have more updates on this one than I probably care to remember. Let's see here. Okay. So the next ones are inclusion is going to be an interesting one to kind of finalize with John. So it's right now, this is a really, really terrible draft to show you. So my apologies. So what we're going to do on this one to kind of explain is we have to renumber a couple things and we have to take out some things that we have not been able to move forward because it was just not possible or you know, prior to John beginning, Erica probably had a different idea about how to move forward on some of these things. So the first one really talked about strengthen at least 3 activities and activity to expand best practices and languages around transition, linguistic accessibility, and use of plain language. Right now, there was what got crossed out is working to work with disability partners to ensure key documents are translated into Denai, the Navajo language. We have no idea what that really meant and what sort of key documents. So, and because no work had been done prior to this in 2024 or 2023 or in 2022, it's been carried over. We are scratching that out. And that's one of the things that we can continue to look at or address at a different time. John?
Yeah, I just wanted to note that throughout the course of the last couple of years, I've had conversations with people at DES, DDD, Access, you know, trying to get a sense of what might be appropriate to translate into Dene. And basically the answer that has come back to me repeatedly and very recently is it's not necessary. I mean, it may be necessary, but there's nothing that they can think of that would be appropriate for us to do. There are tribal liaisons, there are tribal organizations that work with the population on the Navajo reservation that also work with state agencies and for the most part provide the resources they need, whether orally or visually. So because Dene is not a written language, it's sort of impossible for us to translate documents unless we do it in video format. So basically, keeping this on our work plan would be essentially a waste of our time and a waste of space on the paper. So we're moving forward without it, and the state agencies assure us that they can provide what is necessary. And if they come up against something that isn't available, then they'll come back to us with a request for assistance. But it's that you know, just to further explain what Marcy has shared with you, we're at a point now where it's no longer necessary to keep it on the plan.
Thank you. We are keeping the first bullet point. We talked about working with the DES refugee resettlement and Sonora, and you said partners. So we're going to say strengthen an activity to expand organizational best practices. So we just move it to a singular type of project that we can track. And then the performance measures and the output and outcome statements would be redone. The second activity stays the same. Those are all the constituent calls that our offices receives that are tracked. Thank you to Sarah and Jason and John because they take the bulk of the calls. So we normally have more than 12. So we identify some of the key ones. The third one, the data hub. We have had a couple of meetings now with Dr. Kurz, which has been really great. He has been able to download the data from Division DDD, basically Division of Developmental Disability, for, I don't know, almost 10 years, I guess, data going back to 2016, almost 2015. That will soon be released. He's got to just kind of, he took some of our input and guidance. He's going to maybe showcase it in a different way before it's formally released. This contract is tentatively scheduled to end on September. He's asked for a no-cost extension through the end of January so that he can go ahead and update with the latest census data that will be released later on this year. We are planning to do that, as well as this is kind of tied into a federal extension award letter that Lonnie will be doing because of the award fiscal year he's paid out of. We are also planning to redo a new scope of work that will kind of be a little bit more expansive, but it still be maintenance, but a little bit more expansive of sort of the data that should be collected. And then Alex will go ahead and apply for that. So he is interested in still participating and helping to update and maintain this for Kathy.
So I'm just curious, the data that he's been able to download, has he given you any indication that the data is good or it's just needs to be cleaned up? Those kind of things.
He's just going to showcase it in a different way. He has all the data. So obviously it's broken out by county. You can look at it by county. You can look at it by the different categories that DDD has, but it's just a matter of how he wants to showcase it so that, you know, you can do comparisons per year or comparisons per disability. So it looks really good, and it's non-identifiable. The biggest part of that took so long was to make sure we had to have an agreement in place with DDD. That took some time to get in place and signed off. And then the second half of that, it took a lot of time for him to work with the folks at DDD who authorized the data to make sure that it was going to be downloaded in a way that was non-identifiable. So you get into some of the rural counties, and they may only have 40 people who are identified as having being autistic or autism on the spectrum. We wanted to make sure that that was not going to be a way to showcase anyone, that anyone could be identified if you're in a rural county and the numbers are really small. So he just has some minor things to just do. We've reviewed it. It looks really good. We're really pleased with, you know, the work that at the time it's taken for him to do the work. So I think it's just another, we have a meeting coming up again to kind of, I think pretty soon, another 2 weeks. It should go live with hopefully by the end of September 30th.
Oh, good. I was just curious as to, it just helps us to know is the data going to be that it'll help us to know where we need to maybe provide support or more resources, or just educate us more on the IDD community? Is that?
Well, I don't think anyone had an idea of the numbers that have increased. I think the numbers show, obviously, it's any family members who are under DDD services, you see the increase. So as you see the increase of population, you see an increase in the number of services that are provided for families. So it's jumped from like 35,000 from even like, I think, you know, the lowest year to almost like over 40,000. So that's one thing you could look at. You know, you could see the trends. Obviously, you know, I think the part of it too is we needed local data. You know, part of what we have to do in our next 5-year plan is to summarize where the gaps and needs are with services and supports, and we need to know what that data looks like, how many people are receiving supports and services. Obviously, there's more people with disabilities that do not receive DDD services, but I think it just gives you a window to see, you know, what those numbers look like.
Okay. All right. Thank you.
Yeah, Marcy and Lonnie and I met with Alex a little earlier this week, and he sort of gave us a demo of what the DDD data is going to look like on the site. And you know, it's not perfect. There are going to be things that we're not going to be able to discern from that data, but it takes us a lot farther down the road than we were in the original iteration of the data hub. So we can do, as Marcy said, we can do comparisons over time. We can look at, for example, the shift in autism diagnoses, which have gone from, 2/3 of the overall ID diagnoses to now more than the ID diagnoses. We can see county by county. We can do a comparison of male to female. We're going to be able to look at much more data than we had before. And over time, if we stay with this project, we will probably be able to incorporate more forms of analysis than we will have in this first version. As Marcy said, it had taken, it seems like a lifetime to get DES to provide the data, to approve the data, to allow Alex to put it into a usable format. We do want to be very sensitive to the fact that we don't put anyone in a position of being identified because of those low numbers in certain counties. But in terms of us using the data, not only will it help us with the next 5-year plan, it will help us on an annual basis to look at the counties where there are smaller numbers, perhaps, of DDD members, and we can do some comparison with the services being provided in those areas. We can, if necessary, do advocacy to improve or increase the resources being made available to different parts of the state. I think if we're very thoughtful about how we use the data, we can be very effective with it, and even more so, the general public is going to have access to it, so they're going to have a pretty thorough picture of what the DD service system picture looks like around the state. That being said, it is only for DDD members, Alt-Text members. So what it leaves out is something that we're always very aware of, and that is the fact that 2/3 or more of the people with an IDD diagnosis in Arizona do not receive state services. And so there's a large population that is not going to be reflected in this data and that is not receiving services, but in many cases needs some kind of services. So that's a whole different ballgame that we're going to have to address over time. In the meantime, we're going to have a much better picture, at least, of the DDD service system and the recipients of DDD services through every county of the state, and in some cases with pretty good detail about specific diagnoses and some other factors involved. So I'm pleased with where it's gone. I'm sorry that it's taken so much time. I know Alex has been frustrated by that, but I think we're in a much better position to be of service to the community with this information than we were 6 or 8 months ago.
No, I'm excited about this. What I can see also is that you will see how many youth are coming into, how many could be referred to Voc Rehab for support there too. If there's a wave coming of kids that are going to be applying to Voc Rehab or should apply to Voc Rehab for support, then you can even see that. So I think it's neat. I'm really happy about this. Yeah.
Okay. Thank you. All right, moving on to the second one. So we're gonna have to restate a couple of things under one, which is the second objective is around initiatives to address transportation related challenges. Jason is the lead staff for this and has done a really good job, but he's also working with the County of Governments, MAG, and NACOG, and then also we know that the Self-Advocacy Coalition, the ARC of Tempe, they have just released a transportation video that they did on transportation barriers up on the Navajo Nation. So we're going to try to figure out a different way to help support this objective. We know that there's a policy brief that Jason has worked on, barriers of northern transportation, and then he's continuing to meet with the working group around the barriers. And so we want that policy brief to be finalized and then released. And then the second part of it is whether next steps to do with that transportation brief. Is it something that we put in the next work plan in 2026 so that we know how to move forward? So we're going to be meeting with Jason and John to kind of rework some of the language around here. So you'll see stuff that's crossed out a little bit because we need to make sure that it speaks to what Jason is doing and how we can move forward on it. Part of this was to set funding aside for a transportation project, We don't know whether that is going to be realistic or not. So we still need to kind of have more discussions around 1A. So we kind of right now just crossed out that there was going to be a release of a solicitation. There's no scope of work that I've worked on. And also one of the things that, you know, that I kind of, that Jason and I have been doing is just seeing what other councils are doing around transportation. There's only been one council I've identified that had a solicitation released around transportation, and that was New York. I think it was the New York State Council. And so we could go back and look at that particular scope of work if it's realistic and it's something that we can do. John, do you want to add anything around transportation about reworking it? Okay.
No, but if Jason, you have anything you want to throw in, please do.
Actually, you did a very good job, so there's not too much I want to add there. I would say that there's actually a lot of funding around transportation with the infrastructure bill and stuff, and there's a lot of nonprofits trying to do some stuff. So we'll see how that goes and how we can work that into our and assist with that. So
we know that didn't MAG receive a grant?
Yeah, they got a grant from Humana for $126,000 initially, and then if it goes well, then they get an additional $126,000. And Ryan and myself are part of that committee that sits on that steering committee to help them spend the money. So hopefully it works out and we can make a difference with that. But in terms of how we can help, we need to sit down and reassess what we can do and that kind of thing. So that's all I got.
Yeah, you know what I would throw in? I would throw in one other thing, and that is that Jason and Ryan Berry from the Arc of Tempe have been in contact with Representative Greg Stanton, who serves on a transportation subcommittee, I think, in the House of Representatives.
Okay.
And he is very interested, although his district doesn't cover rural areas, it's based here in the Valley. He is very interested in transportation issues that affect the entire state of Arizona. So we will try to use whatever leverage we have with the federal government, as well as the resources that have been provided at the local level, to see what changes can be brought about through these various programs.
Correct.
All right. Moving ahead on the next objective, the third one. Okay, so the third one, let me see here what I want to highlight here. We are going to keep 1A. So this talks about creating and sharing new information and resources for families and caregivers and in the community. We are working, this has been something that Jason and Sarah have been engaged in, more so Jason. So thank you for all the hard work he does on creating videos or working with self-advocates to create videos on topics. So the next step is to finalize the videos into Spanish, to get them translated into Spanish. Sarah and Jason have talked about next year to identify Spanish-speaking self-advocates to create videos so that we don't have to worry about translating them into Spanish, but more translating them into English now, but find different ways to be more inclusive. And so I think that would be a great way to continue with this particular activity. So we're going to keep it and add it into the 2025 and 2026. We see here 1B. This is the one where I think we wanted to talk about. Okay, so 1B, conduct a survey members. This is the community survey. So Sarah and John have drafted questions, I believe up to 25 questions that are going to be released. They're going to just finalize those questions here. So added to 25 will actually be rewarded to say that the council will utilize the findings from the community survey to address community needs, identify key policy related issues, and implement appropriate program recommendations internally so that it follows. So we release the survey, we get the data in 2025, it's the analysis of it and how we're going to use that information to move forward. So that should be a one-time thing. It will not be forward into 2026. So that will be going out. we'll hopefully have
And,
Dave
and
you.
sorry, I apologize, Marcy. I just wanted to make sure we're clear that the verbiage under 1B that's lying through actually does apply to fiscal year 24 this year. We'll be releasing that survey in just a couple weeks. It will be out for 3 to 4 weeks. Derek can correct me if I'm wrong about that, but it is going to be open for a defined period of time, and then we will have the results within this fiscal year. We can begin analysis and so forth. That the primary portion of that work will take place in fiscal year 25. We do expect that this information to some degree is going to support the work we do in planning for our next 5-year plan, but we may have to do another survey down the road, not too far from now, to get even more information. We have to do a comprehensive review and analysis for that next 5-year plan. So there may be some more community surveying done. There certainly will be some focus groups and some community outreach related to that. But for now, we're going to try and use the information we find this year to help inform the work of the next couple of years. And Sarah, please jump in with any additional information you have.
You covered it well.
Megan, did you have a question?
No, but I fell off and I just came back on.
Okay.
Sorry about that.
No worries. No worries. Okay, 1C is around some work that we're partnering with Kelly Carbello, and it's around some legislation that passed a few years ago about emergency operations planning for school districts, especially that they ensure that students with IDD are part of an operational emergency planning, that they're not left behind, or that there is a way to ensure that everyone's safety. And one of the things that the council has been working or kind of going to continue to do is we want to readdress some of the outputs and outcome statements to ensure that we are raising awareness on how this new state requirements can be implemented at the local school district. We don't have any control with Arizona Department of Education, you know, as far as how they will go about doing it, but the council can certainly take a role in helping to raise awareness, whether we create information, post on our website, whether we do a webinar around this with Kelly Carbello. So we're going to work out some additional language around this that talks about education and training to communicate. And then we will make sure that the outputs and outcome statements reflect that. John, anything here you want to clarify on that?
No, you said it right. We don't have any control over the Department of Education and their oversight to make sure that these things happen. We do have a new ADE member coming on the council as soon as his appointment is approved. He does happen to be the head of dispute resolution for ADE, so perhaps that's to our benefit. We will have experience working with parents who are unhappy about the degree to which their students are receiving the education they're entitled to and the services they're entitled to. So we'll see how that goes. But we will absolutely be working. And this is something I know that is very near and dear to Jason's heart. It's very near and dear to Kelly Carbello's heart, and something that is a long time in the making. So we need to make the most of it.
Okay. All right. 1D. This was around the renewal second-year contracts for the projects addressing pregnancy and parenting of individuals with IDD. The 3 contracts went to U of A, NAU, and ASU. They were just renewed by the council, so those will be listed in the work plan for 25 and potential third-year funding in 26. And the last one, 1E, is the contract that we just awarded to NAU for assistive technology research, but it's actually going to be a little bit more. They're going to, this is the contract for $50,000 that they are going to help the students that were part of almost the Think College project that the council funded for 4 years. They're going to continue to try to increase awareness about the benefits of AT used to improve academic and performance. And they're going to reach out to K through 12 students in 4 different school districts in Northern Arizona. And so it really is to figure out ways that once students have assistive technology, how do they maintain it? How do they keep it? How do they self-advocate for the right assistive technology to assist them in schools? And then thanks to the review committee who kind of looked at the applications, we wanted to ensure that they started younger in K through 12 education and special ed, so that those kiddos have a way of understanding what assistive technology is and the benefits of it. So they're going to do some outreach in this contract period. We do hope that that they'll come back with some really good reporting and data, and so we can consider them for a second year, and they'll be listed in 2026 eventually as a second year contract. Any questions on this? Anything from the inclusion?
I don't have any.
Okay. All right. So
Me neither.
safety. Okay. So safety is the next goal. Let me get my notes out. The first objective, we are going to make a minor change from conduct at least 2 trainings, distribute materials focused on raising awareness of types of abuse, neglect. We're going to drop this down to conduct a training. In the past 3 years, we did have 3 different types of contracts to support this objective. And now some of those contracts are falling off. And so now it really is to support the latest new contract that just went into place, which is to NAU for the development of a pilot training around I'm like spacing out on internet usage, basically the safety all around apps and internet safety. And the target group is going to be 2 different groups, 18 to 24. And then they're going to also do a different pilot for 15 and 17-year-olds. And they have identified different sites around the state. So this was to continue part of this contract was to ensure that we are looking at also those folks who get on access to online environments. How do you protect them? How do you stay away from fraud or perpetrators who are out there to scam and harm people online? So they are addressing that through a 1-year contract as a pilot. If it's successful, we're going to renew this in 2026 as a second year. The next thing, if you could just scroll down, the contract for ACES-DV it will end this September 30th. So this was a 3rd-year contract, so it would be crossed out in the 2025 work plan. They were doing a number of trainings with the ARC of Arizona, and they still continue to do them. And so we wanted to, this was the 3rd year, and they were notified in the beginning of the contract period that this would be the 3rd and final year. So this will fall off. And so therefore the outputs and outcome statements reported in the PPR. The next one, scrolling down, a while back ago, you may recall that we had the collaborative with the ARC of the U.S. to expand the Sexual Violence and Disability Network. We only awarded that contract for 2 years. We were not very, it was difficult to see the outcomes and the performance of it, of what it was meant to do. And so we took a break, and then we redid a contract, a new scope of work earlier this past year. And basically, what we need to do is just finalize that here. So where you see 1C, new and updated, we had a new collaborative solicitation that was released about 6 weeks ago. We have 3 applications that were received. And basically, it was taking the recommendations, some of the recommendations from Dr. Lynn Tomaso's report. If you haven't had a chance to read it, it is excellent. It's on our website. It's on her website on sexual violence told through lived experiences. So it's a really important piece of work that she did, and it took 3 years for her to complete. We took her thoughts and recommendations to create the scope of work for an applicant to address. So we hope to have that finalized by next month for the council to determine and to make a recommendation. And then that will address this particular activity to go forward. I will say that we identified really specific key activities. It is still to coalesce a collaborative group. They had to identify the members that would be on this collaboration and how far and how often they will meet. And they had to address policy, at least a minimum of 2 policy changes. They had to at least address legislative changes, a minimum of 2 legislative changes as well. And then there were optional activities they could determine to be a part of their project as well. But it's going to be a handful, and we hope that whoever's awarded this will continue to move this topic forward because it's really important. Any questions? I know it's a lot of scratching out, but we had to, it takes time when you scratch out. If you don't award a project for a 3rd year and you're going to go back to the drawing table to draw a scope of work, it takes some time to work it out. So that's basically what we did. So I'll develop the outputs and generic outcome statements for that. With no questions, we'll move down to number 2 here, 3 and 4. Those are all continuing the same. They have not changed. John works with DES, DDD members are informed. Number 3 doesn't change, support at least 1 policy change, promote safety in people with IDD. Number 4 is we just reworded this to say as part of the Grand Canyon Collaborative. So it's still with these partnerships that we're still working with to raise all types of awareness on abuse and neglect factors. So that doesn't change. And then we'll have to add new outputs and outcome statements. I'll work with John on those. Number 5 did not change too much. It's still to promote a consistent statewide system identifying individuals with IDD in the jails and detention centers. What we're going to do on that one is there is a report that was finalized. Jason worked on this one as well with a researcher up in Embry-Riddle, I believe, University up in Yavapai County. Now the next steps is to finalize that report with any final changes and distribute it. And then obviously the council to look at promoting and recommending any policy improvements that we can put forward in the work plan. John, Jason, do you want to add anything to that or anything?
No, you did pretty well. I know we plan to contact some judges and see if we can get some them to hear us out and see if they like the recommendations and see if they have any thoughts and how to accomplish some of those things. So, anyway. But
Thank you.
Kathy?
Oh, I just wanted to add to what Jason said that we're trying to work with VR because of their counselors that work with juvenile offenders. See if they can make a recommendation on what judges are more amenable to working with us. And Kristen Mackey put an email out to her counselors to try to see if they could give us suggestions or recommendations of what judges we could work with. So I just hadn't been able to tell Jason that. Sorry.
That's awesome.
That's really helpful. Thank you. Thank you.
Yeah, I wanted to touch on a couple of things. First of all, going back to the ADDPC grant, the training grant that was provided to them. Marcy and I did a lot of work with them to refine some of the information they were including in their trainings about people with IDD. As she mentioned, they work very closely with the ARC of Arizona to do further refinements. And this, I think, we often talk about the need for sustainability for the projects that we fund. We can't fund them forever. They're at some point going to have to stand on their own. This is one where I anticipate ACES-DB is going to continue utilizing this information over the long term and continue to update it and learn more. So I think this is a success story for us in terms of sustainability. I can't speak to exactly who their funders are going to be moving forward, but I know that they have, through the course of their work on sexual violence as part of the Sexual Violence and IDD Collaborative, as part of this training, as part of some of the events that they do, they have really developed a commitment to this work. And as I said, I would anticipate they're going to continue to use this information over the long term. And I feel really good about that. It feels like it's a real win for everybody, and it helps expand the audience for information on this topic. With regard to Dr. Lynn Tomas's report, if you haven't read it, I highly encourage you to do so. I believe we have it available on our website now. It's pretty disturbing. I have to warn you about that. But it is, for Arizona, the first of its kind exploration of the lived experiences of individuals with IDD who've experienced sexual violence. whether it's abuse, exploitation, what have you. Really fine work. Took a long time to get it. We all recognize that. It was more than a year. Extensions provided for more than a year, almost a year and a half, in order to give Lynn time to put the work together. But it's going to be very valuable. And we've already had conversations with people at DDD, at other state agencies, at private provider agencies who have read the report and who understand the magnitude of the issue they're dealing with. Now our job is to move forward with getting people together to actually make some changes. Not enough has changed since Hacienda, not enough has changed over the last few years. So there's a lot of work to do, but we now need to use what we found. And this grant that we're going to be supporting, this contract we're going to be supporting, I think is an opportunity to really begin that work and really bring together the players who can address policy changes that have to take place in this area. And then finally, on the criminal justice report, I cannot overstate how grateful I am to Jason and to his colleague at Embry-Riddle, who have worked on this report, done a tremendous amount of work related to the justice system. It's an area that for whatever reason is often overlooked, and yet the circumstances in jails around the state for people with IDD, especially those who are not recognized as having IDD, is pretty dire. And so this report should shed some light on that situation and offer some recommendations for how we can address the situation, and we can do better for people with IDD. So kudos to Jason, kudos to Diane Orman at Embry-Riddle. We will have the final edits done on that and have that ready for distribution in the very near future. Sorry to take so long with that, but I feel like in the safety area, the last year and a half has been kind of a watershed moment for us, and we've been able to produce some really outstanding work as a result of that. And now we can take the next step.
Sarah, before you move on to number 2, go back to number 6. Sarah, if you hold on one second, let me just make a comment here on number 6, kind of to piggyback what John is saying. Part of number 6 got crossed out was engaging with law enforcement agencies and around appropriate education and training. Again, it was difficult to kind of figure out how to go about doing this. So what I did was make it a requirement in the solicitation that was released that we just received. They had to include law enforcement agencies and service providers and rural communities to be identified, or those participants in rural communities, as part of their collaborative team. So, we didn't want to leave this one out. We just had to figure out a different way of tying it back in. So as part of their collaboration group, who was going to be on their team, they had to make sure that they were going to bring law enforcement and tie that in, so that those folks are trained and understand the difficulty of individuals with IDD who have been impacted with abuse and neglect and sexual assault. Okay, Sarah, back to you. Sarah.
Sorry, I pressed the wrong button. I put in the chat links to the report, our press release about the report. And then I've been checking, and it is finally posted. We had an opportunity to appear on the Arizona Horizon show last night. John did a great job talking to Ted Simons, and that went out statewide at 5 o'clock and 10 o'clock live, and they now have the recorded full episode. I'm still waiting for them to upload the individual clip, but you will find that at about 10 minutes into the show. And that's that second link if you want to see John talk about Lynn Tomas's report and talk about the council's work in the safety area.
Thank you. It was good. I saw it. All right. Number 2, moving ahead. Okay. This is going to be a big change again. So this activity here is really rewritten to support 1A and 1B. Both of those had individual solicitation award amounts of up to $50,000. One was to address trauma-informed training. The other one, crisis behavioral and health training. Difficult to work on and try to figure out the last year and a half with John about how this was going to move forward. And basically what we did was combine both of those to address one one potential ISA contract with the Sonoran USED. We had conversations, or I should say, John primarily had a conversation in the beginning with JC to see if she would be interested with the USED and her folks to work on this particular project here. So we hope to receive a draft proposal here in the next 2 weeks about how they're going to collaborate with stakeholders to address trauma-informed training and the crisis and behavioral health aspect of it. And then we'll provide some feedback to her to see if how the approach is going to be sustained, multi-year contract. And then if that's the case, if it could be something that we could present to the council, we will for determination of an award. So we kind of had to redo this and kind of reimagine this, and JC was willing to at least try to take a stab at it. Scrolling down to the next one under one, cross this out because this was the work that Noble Predictive Insights did for a research report that you guys have. So we're going to address this as a new activity under number 2 to move further. So this is the next step. You got a report from Noble Predictive Insights, which was going to help develop this new activity. Number 2, the council will propose 2 policy improvements that will address the shortcomings in behavioral health and crisis response for individuals with IDD. So that's a new activity that you guys are seeing for the first time, but something that John and I kind of discussed about next steps, because obviously this report is something that's really important that was done and took some time to get some work done on at least the contractor to do it. And so we're going to move forward on that if there's any, and then we'll develop some outputs and outcome statements. Any questions on safety? I know it looks really different. There's a lot of things crossed out.
I don't have any.
No questions, just a comment. I'm excited about the work that we've got in there. Great job, guys. Thank you.
Yeah, I agree too. It's well done. Thank you.
Thank you. Okay. We're almost there. Last one, which is going to be the systems access here. Okay. All right, just a couple things on this one that we're going to highlight and make a couple of changes. So number 2, we know that the how-to guide, that Mary Slaughter and now Sarah's on board, has been working a lot on making sure that this how-to guide moves forward. So Sarah, this is new for you. I haven't had a chance either to talk to you about it, but we hope that you will work on to develop a communication plan to promote and share. It should be pretty easy. It's like how we're going to promote this how-to guide once it goes live. So yes, I know you love communication plans. You know the best way to move forward on it. But basically, a lot of it is pretty much done. I think it was just kind of tweaking it. I think there was a pilot to get some survey feedback on it and make any changes to it. Really appreciate the intern that was able to work on this for the last, 2 years, it seems like. But now we want to promote it, and we hope that Sarah will take the ball and run with it to develop a communication plan to share it. And then we're also want to continue to evaluate and analyze the feedback and make it better. So that's going to be ongoing for 2025 and 2026. And Sarah, there you go. And the new marching orders. Love you, girl. Okay, moving ahead on the next one. So number 3 and 4 are kind of redundant in how they were created. And so John was going to redevelop an activity still to address elder care and the need to provide supports and services. And he's also kind of reported out that we are recipient, I think the 17th state to receive funding from NACDD, the bridging. You'll have to correct me, John, and I'll let you speak about this, but a lot of work with the collaborative group to address this topic. So we're going to refigure number 3 and 4 to be an activity to address the elder care population and support and services. John, I'll let you speak about how you.
Right. Essentially what we're going to do is combine 3 and 4 into a single activity that supports the work of the Bridging Aging our Bridging Disability and Aging Community of Practice. It will include language that is currently crossed out, but as I said, we'll combine language from both of those activities into one. We will be using the research results that we found from our Public Health Workforce Development Grant that was part of our COVID funding. That was the work done by the Regional Center for Border Health and the Sonoran Center. The work will focus on the 50+ population and the way that the state service systems are supporting or not supporting that population and what we can do to try and move the needle on that. So apologies for not having that in there right now, but essentially it's going to be those two activities combined with some new wording related to that population and specifically mentioning the community of practice that we're now part of.
Okay, thank you. All right, moving on to objective 2. We had a change here in just this first one, just to rework, develop a program or policy recommendation about the report on the refugees with disabilities. So with that report is completed, we need to disseminate the report for review and recommendations. And then again, with the council collaborating with DES to support a minimum of 2 program or policy changes to enhance services and supports for refugees with disabilities. So last year is about making sure the report was done. It has been done. It took a while for it to come through. And then we want to make sure we move forward on that report with any sort of recommendations the council can take. So that will be just a slight change and to carry over through 26. Scrolling down, we are, John is going to keep number 2, where he meets and has meetings with partners about access to health access and health equity in underserved areas. And so we're keeping that activity there. And then the last one, targeted disparity, that particular project with the Sonoran you said is going to continue through 2026. Again, JC is working on her renewal application, and we hope to receive that in the next 2 weeks so that we can review it and present it to the council for review and discussion and a vote. Any questions? Anything I left off, John? No. So I hope you see this is kind of still streamlining. We're always reviewing our annual reports. We streamline them as much as we can, try to take out some of the redundancy. I have to tell you, I presented a draft of one of Michael's to ITAC training. Folks loved it and wanted copies about how to do it for their own councils, because I think what I said in the very beginning when we thought about this, even though Lonnie created, and I appreciate Lonnie creating a very large Excel version one that had a lot of different columns and information, but one that keeps it simple for us and for you guys. The intent was to track and to make sure we were accountable to ourselves and be able to show progress and accountability from you guys holding us accountable to what's going on. I think we're seeing the payoff. You know, this is a lot of work to do, and it's a lot of work to manage a big project like this. But I really appreciate everyone that participates in updating the work plans and being able to share with you guys and taking your input and recommendations. It's very helpful.
Go ahead, John.
Sorry, I just wanted to ask Lonnie, and I don't mean to put you on the spot, Lonnie, but I wondered if there are any particular financial issues, budgetary issues that you would like to address related to the work plan as it looks for next year.
No, nothing to add at this point. We're closing out the last state fiscal year and re-encumbering funds. So things are kind of in a state of flux right now, not knowing what grantees are going to end up spending, if they're going to spend their full award amount or not. So yeah, I will keep you posted should something come up that you guys need to be aware of. That's it for me. Unless anyone has any specific questions.
I do not.
I don't either.
Thank you.
The one other thing that I want to just touch on, and we've mentioned it a few times, is our next 5-year plan, or our next state plan. We are now finishing the 3rd year of our existing 5-year plan, which means that next year, at some point in calendar year 2025, we will begin the process of developing the 2027 to 2031 state plan for Arizona. That will, I know it's a bit down the road, but the process of getting that together, getting council approval, getting community input and so forth, as many of you know far better than I do, is a pretty lengthy process and involves a lot of meetings. It involves a lot of review. It involves a lot of input from folks around the state. So we'll be beginning that process next year. There is no requirement that the current goal areas remain the same from plan to plan. And in fact, I anticipate that we will be revising or perhaps changing outright some of the goal areas that we include in the next 5-year plan. We will, Marcy mentioned the input from this committee and the input from the council as a whole is really invaluable to us as we do this work. And we will be asking this committee to be providing ongoing input as we work through the development of that next plan. So just a heads up, maybe a warning. If you want to run for the hills now, we wouldn't blame you, but there will be some work involved, some a number of meetings and so forth involved, and we really will need and will value the assistance you all provide as part of that work.
John, are you required by ACL to do like a needs assessment? And I'm only asking this because in maternal child health, we always had to do a needs assessment prior to our 5-year work plan. And if not, my comment is that I think the data from ASU, I hope he gets it to you so that we can use that as part of, the new work plan when we need to. That's my only comment.
Well, absolutely. The information from the Data Hub, the information from DDD will be really essential for us in helping to identify community needs and where the gaps exist that we could potentially address. In terms of a needs assessment, I'm going to have to defer to others on the staff who've gone through this before. I do know that we have to do a CRA, which I think is essentially equivalent, but correct me if I'm wrong.
It is
Marcy or Mike.
What does
Okay.
that stand
Okay.
for?
a comprehensive
Sorry.
review and analysis.
Comprehensive review and analysis. Yeah.
Okay. Yeah. Same thing. Needs assessment. Okay.
Yeah.
Okay. Anyone have any other comments? Okay. So, I just want to make sure we've covered everything on agenda item C, right? John and Marcy?
Yes.
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 So as we move on to D, committee input on work plan proposal, do I have any more input from our committee members that you'd like to provide now, or?
I don't have anything to add, Kathy.
Okay.
I don't either. Thank you so much for all of your work. This looks really great.
Yeah.
Yes.
Okay. Yeah. It's a pleasure to work with you guys. All right. I don't think we have any more comments. I think you guys have been very comprehensive in explaining what you're doing and the changes you've made. And I don't believe at this point it needs to go back to council or anything added that would require it to go back to the executive committee. So you don't need a vote from us, correct? You just...
I don't think we need a vote. But we will be, finalizing those areas, those highlighted areas where there's still some information missing. We'll be doing that over the course of the next week or so. And we will provide you all with a finalized version of this plan before we submit it to ACL. And we'll try to give you a few days prior to us submitting so that you can have a chance to review it and you can come back to us with any questions you might have.
Okay. Great. Okay, so moving on to E, we need to schedule our next work plan review committee meeting, and we usually are doing it in quarters. So in November, is everybody okay with a date in November? Or do you need something from us, John, before that?
No, I don't think there's anything required of you before then.
Okay.
Just as a heads up for November, in all likelihood, we will be having a council meeting on November 15th.
Mm.
That's, I mean, it's tentative, but it would fall within the sort of cadence that we've been adhering to. So if it would be possible to have a committee meeting prior to the council meeting, that would be helpful.
Yeah, I think that would be great. And we'll have an executive committee meeting on the 8th, right, of November?
Yeah. Now we might switch that since Thanksgiving falls later in the month this year.
Okay.
We might do the 15th and 22nd. We'll see. But yeah, if we could do a committee meeting within the first, let's say the first week or two, that would be great.
Is everyone available on the November 1st or October 31st for a meeting at 9?
I'm checking my calendar. At this point, Friday is a better day for me than Thursday. So
Okay.
the first week, I have a client I see at 9 or 10 o'clock. Yes.
Okay. Bianca and Megan?
I agree. I think Friday would probably be the most likely that I'd be available for a meeting.
Okay.
Yeah, Fridays are best for me just because I kind of have them blocked out in advance for
Okay.
these.
Great. All right. So John, I think November 1st, Friday, November 1st at 9 a.m. works for all of us.
Excellent. I will send out an invitation.
Okay. Great. Well, I think this concludes our meeting. Unless somebody has some comments or any updates they'd like to provide.
No, I just want to thank our awesome staff. You guys worked so hard on this plan. And I was look at it and I'm always amazed. Talk about project management. So thank you so much.
Yes. Yes.
Appreciate you all.
Yeah. And thank you for sharing all the links you did in the chat box. That was good. We'll look at
Yes.
I'm
Thank
excited to see John in a tie and see what he says.
Thank you.
Yeah.
All right.
Okay.
So I think we are closing and you all have a great weekend.
Thank you,
Okay.
Kathy.
Thank
you,
you very
everyone.
much.
You too.
Take care.
Thanks,
you all.
everybody. Have a good week.
Council members, have a
Bye-bye.
good weekend.
You too.
You too. Bye-bye.
Bye-bye.